undergo this type of a movement. And how is that possible? That is possible. Right? These are all instruments made, innovated by me, and we do it. We have worked with fabricators to make these things. Therapy for the lateral canal. The patient stands on a platform like this, which is rotating. The patient first does it with the eyes open, holding onto it. Then the patient does it with the eyes open, without holding onto it. Then the patient does it with the eyes closed, holding onto it. Then the patient does it with the eyes closed, without holding onto it. And lastly, the patient does it on a soft surface and with the eyes closed. So that is how we slowly make it more and more difficult. So organ-targeted protocol for stimulation of the lateral canals is that the patient first stands on the rotating platform with the eyes open, holding on to handles. Then the same with the eyes closed. Then the patient stands on the rotating platform with the eyes closed but not holding on to the handle. Then the patient does the same thing on a foam pad on a rotating platform with the eyes open. Then the patient can do it standing on a foam pad on the rotating platform with the eyes closed. So make it more and more difficult, and the patient system gets stimulated in different ways. Supposing your tests have shown you that your anterior canal is defective. Then if the anterior canal is defective, this is the type of movement that you try to put in. So how do we do it? Or if the posterior canal is defective, then this is how we would like to stimulate this thing. Now the VHIT test and all these tests can tell you that your posterior canal is defective, or anterior canal is defective, or sacral is defective, or utricle is defective. So if you are doing these tests, then you also have you should have the mechanism to stimulate them also. Now in our clinic, this is what we do. We make the patient sit like this, and here we are passively stimulating the right anterior canal and the left posterior canal. So these things are all possible. Now this is a passive way of doing it. Then we can also do it actively. That means you ask the patient to look at the top of that traffic marker, and the patient puts the head down in that particular fashion. That way you are stimulating the anterior semicircular canal of the right side actively. So then this is how the posterior semicircular canal of the right side and the anterior canal of the left side is being stimulated. Then supposing your tests have shown that the sacral is defective, then what should you do? This is how we would want to stimulate the patient's sacral, up and down movement, because the sacral senses up and down movement. Now what do? I've made a chair like this where you can stimulate the sacral in different frequencies. This is for low frequency stimulation, the hydraulic system, and then this is a mid-frequency stimulation where the patient sits on a gym ball. This is a high-frequency stimulation where the patient is stimulating the sacral by jumping on the trampoline. So these things are all possible. Then supposing you have found that the utricle is defective, then you need to stimulate the utricle. What is the function of the utricle? Front, back and side-to-side movement. So if you want to do that, then we have the mechanisms to stimulate front, back, side to side. All these things can be done very, very well. So this is this is the side to side movement. So that is how we would like to stimulate the utricle. So how do we do it? This is a mechanism, a hydraulic mechanism that I have made. The patient does this here. The patient is being moved horizontally. Patient is holding on to these handles. Then the patient does this with the eyes open. Then with the eyes closed. Then the patient does it standing on a foam pad with the eyes open. Then the patient does it later on standing on a foam pad with the eyes closed. So see, these things are all possible, and the speed of this thing can be changed also. You can increase the speed and decrease the speed also. So this is how these things are done, and we now have the mechanism of stimulating the different organs separately. Then we can stimulate the proprioceptors also. We have got in our clinic things like this by which in different surfaces we can make the patient walk. Then we have a system like this which is attached to a motor, and the patient starts with the thing a little soft. Then we gradually increase the air inside this thing, and the thing becomes more and more tighter, and the patient practices on that. This is a way of stimulating the proprioceptors. Then we have got the virtual reality systems. by which you can expose the patient to different types of simulated situations. We are not going to the different types of vestibular physiotherapies. Like we have by vestibular physiotherapy, the virtual reality. We make the patient wear the goggles, virtual reality goggles, and then there are two skyscrapers. We connect these two skyscrapers by a plank of wood, say 6 feet wide, without any railings. We put the plank on the third floor and ask the patient to walk from one skyscraper to